Hello, my name is S.Reyes, and I'm a registered nurse. I'm enrolled at Pensacola State College in their Bachelor of Science program, and this will be a head-to-toe assessment. I'd like to get started. First, I'm going to wash my hands. Come on in, Aaron.
Hey,
Hi, Aaron.
how you doing?
Doing good. Thank you for coming in today. Now, Aaron, you understand that this video assessment is going to be viewed by my instructors, right?
Mm-hmm.
All right. Well, I've done basic history. I've attained a height and weight on Aaron. He's 22 years old, 5'11", and 187 pounds. His BMI is 22%. So now, as Aaron walked in, I'm doing a general survey. He appears his age. He is alert and oriented. His skin color, nutritional status, and posture are good. He is free of deformity, and he moves with an ease of mobility. He uses no assistive devices and has no involuntary movements. He has a pleasant effect and is in no distress. His speech is clear and appropriate, and his personal hygiene is good. Now, let's check your vision. On this Snellen chart across the wall, if you'll cover one eye and read the lowest possible line.
P-E-Z-O-L-C F-T-D.
Very good. And the other?
P-E-Z-O-L-C F-T-D.
Very good. It looks like you have 20/10 vision in both eyes.
Awesome.
Well, come on around and have a seat. We'll get started.
Alrighty.
We'll just take a look at your hands. I'm looking at your skin to make sure that it's all intact. It looks like you have a little spot here. Something got scraped.
Yeah, just a little boo-boo.
Uh-oh. I'm looking at your fingers. Your capillary refill time is good. All right. Okay. Now let's get some vital signs. All right. It looks as if Aaron's respirations are 16 breaths per minute. His heart rate is 62, and his blood pressure is 118/64. That's pretty good.
Okay.
I'm going to start by inspecting your head and your scalp. And I'm just looking to see there's no lumps or bumps or irregularities. Your scalp is intact and your hair is evenly dispersed. Your head is symmetrical. Can you smile at me? Just checking cranial nerve 7 when I do that. All right, so now I'm going to palpate your frontal and maxillary sinuses. Any tenderness?
No, it was fine.
Okay. Now I'm going to ask you to open and close your mouth. All right, I'm feeling your temporomandibular joint there. And now your temporal artery. All right, so now I'm going to take a look at your eyes. I'm looking at Aaron's eyes at the sclera, the cornea, and the iris. Now I'd like you to cover one eye and tell me when you see my fingers.
Now.
Okay?
Now.
Very good. All right, so I'm just going to use my pen light to look in your eye. You can look at the wall behind me. Nice. And now follow my pen with your eyes, but keep your head still. Very good. Now I'm going to look inside your eye with my ophthalmoscope.
What will you be looking at when you look inside of my eye?
Well, I'm going to be looking at your ocular fundus, your optic disc, and the vessels inside your eye, as well as the retinal background.
Okay.
All right, very good. Everything looks really good. And I've also checked to make sure that cranial nerves 3, 4, and 6 are intact.
Okay, so my optic fundus look good?
That would be your ocular fundus.
Oh, my ocular fundus, okay.
And your optic disc, which is a creamy color.
So that's cool?
Yep, everything looks great.
All right.
No problems with your eyes or eyesight?
Haven't had any.
That's good. Let's see. Next, let's take a look at your ears. All right? We're just going to look at the auricle and the tragus, feeling for any lumps or bumps. Nothing is sore. Is that right?
Nothing sore?
Well, I'm going to look inside with my otoscope. The ear canal itself and the eardrum, which is the tympanic membrane, are intact. They look good, and they're a pearly gray in color.
Okay.
So now we're going to test your hearing. I'm going to do a little whisper test. So put a finger in one of your ears, and I'll whisper in the other. You tell me what you hear me say.
Monday.
Very good. And now the other.
Tuesday.
All right. Another way that we can test your hearing is with the Weber test, and this is bone conduction. So what I want you to do is tell me if you hear it evenly in both ears.
Oh yeah.
All right. The next test is the Renee. And this test will test bone conduction and air conduction. Now, you should hear it for twice as long as you feel it. All right? You tell me when you stop feeling it, and then again when you stop hearing it.
Okay, it's gone. It's gone.
You do have pretty good hearing.
Alright, it's gone. Now.
Very good. All right, now let's take a look at your nose. First of all, I wanted to see that it's straight, and if you could, cover one nostril and take a breath through the other. Okay, and do the other side. Very good. Going to take a look inside. Don't worry, I won't stick anything in there.
Okay, good.
All right. Everything looks good in your nose. The turbinates and the septum is not deviated. I didn't see any lesions. And do you ever have any problems with smells? You can smell things?
Yeah, I smell just fine.
Yeah, okay. Well, next let's look in your mouth, okay?
It was like a popsicle stick.
Yes, this is a tongue depressor.
Okay.
All right, so open wide. Let me get this. All right. Your buccal mucosa looks good. Your tongue, it looks good. Can you stick your tongue out for me? All right. And I can see your uvula. I'm going to test your gag reflex. Oh, yep, it's definitely present.
It's there.
All right. So now we've tested cranial nerve 9, 10, and can you say ah for me? Very good. And cranial nerve 12. I see that you have tonsils, but there's no swelling, so I would rate those a 1. All right, now I'm going to inspect your neck. I'm looking at it to make sure that it's even and your trachea is midline. I'm going to feel for some lymph nodes. All right, can you bend your head from side to side and turn? All right, and back. Very good. I'm going to go around behind and I'm going to feel your thyroid. So, with my fingers here, turn your head just slightly to one side and down. Now, if you can, in that position, swallow. Very good. And now to the other side. Again. Very good. At this point, if you don't mind, I'd like you to take your shirt off.
Sure.
So I'm going to be examining Aaron's posterior chest and thorax to see that everything's symmetrical with no lumps or lesions.
So want me to take a seat?
Just have a seat and I'm going to look at your chest from the back. Looks like you've been getting a little sun.
Yeah.
I hope you're wearing sunscreen.
It was 10 SPF. I probably should have put like 50 on.
That's true. All right, now what I want to do is I'm going to assess for tactile fremitus or vibrations. So if you could say 99 a couple of times.
99. 99. 99. 99. 99.
Very good. All right, so now I'm going to percuss. Take a breath. Okay. Any tenderness?
No, ma'am.
Okay. I'm just going to take a listen now. Take a couple of deep breaths for me. Okay, you certainly sound clear in the bases. All right, let's check your range of motion. Can you put your shoulders up for me? Don't let me push them down. Okay, that's good. And I'm going to hold your cheek. You turn your head. Oh, goodness. And again? All right. If you would, put your arms out like this. All right. No pain in your shoulder?
No.
Okay. All right, I'm just going to listen to your lungs in the front. Couple deep breaths. All right, I want to percuss also. If you would, lift your shoulders just a little bit. There you go. Okay, very good. That resonance is what we want to hear. That tells me that you don't have any fluid in your lungs.
Good.
All right, so now I want to listen to your heart. If you would, just lean forward just a little bit. Okay, sounds good. I'm just going to get you to lay back.
Okay.
So now I'm going to be inspecting your chest and looking at the precordium for any pulsations, and everything looks symmetrical and good. And if you would lean a little bit to your left side for me, I'm going to take one more listen. Okay, you can lay on your back now. All right, so now I want to lay you flat. Let's see here. All right. This way I can take a good look at your abdomen. So I'm going to assess Aaron's abdomen for color, contour, symmetry, and any pulsations. So the first thing I want to do is listen. So I'm auscultate for bowel sounds and vascular sounds. Sounds like you got good things going on in there. All right, so now I'm going to percuss. Sounds good. Now I'm going to palpate. Let me know if anything is tender.
All right. Okay, so no tenderness or any areas where that didn't feel good? No, ma'am.
All right, so I was checking for your liver, your spleen, and your kidneys, and mostly I couldn't really feel them, so that's a good thing. So, moving on to your lower extremities, do you mind if I take your shoes and socks off?
No, go ahead.
All right. Hopefully they'll just slide off, right?
Yeah, they do.
All right. Ordinarily, I would check your inguinal pulse, but for this video, we'll start with the popliteal. Very good. The post-tibial. Two plus and equal. And dorsalis pedis. 2 plus and equal. This tells me you have good circulation. Now I'm just going to check between the toes. Can you flex your feet for me? All right, and down. Very good. All right. Now let's check your range of motion on your legs and hips. So let's start with, can you run 1 foot down your shin? There you go. All right. Now can you bring both your knees up all the way? Very good. And don't let me push them down. Okay, so now let's just check the range of motion in this leg. And over. Okay. And the other? All right. So, looks like you have great flexibility. So, no problems, no pain in your hips or anything?
No, ma'am.
No pain in your knees?
Not at all.
That's good. Now I'd like to have you set up. Just sit on the side of the bed.
Okay.
So, I have a little tool here, and I'm going to be testing the superficial pain response. So you can tell me whether I'm touching you with the dull side or whether I'm touching with the sharp side.
Okay.
But you have to close your eyes.
Okay.
All right?
Dull. Dull. Sharp. Sharp.
Good. All right. Again, I'm going to have you close your eyes, but this time you tell me when you feel me touch you.
Okay. I felt it on my cheek and on my shoulder.
Very good.
And I felt it on my arm.
All right. Can I see your hand? All right. So I'm going to turn it over. And this time also with your eyes closed, you tell me whether the position of your finger is up or down.
Okay. Finger's up. And now it's down. It's up.
Very good. All right. So now I'm going to hand you something. With your eyes closed, you tell me what it is.
Feels like a pen.
It is. Very good. So now, again with your eyes closed, hold your arms out to the side and touch your nose with your finger. Good. And one more test. See if you can do this rapidly, as fast as you can. Wow, you're pretty fast.
Thanks.
Okay, so now I'm going to test your deep tendon reflexes. I'll start with your bicep. All right, you just fold your arm out a little bit. All right, and now tricep. All right, brachioradialis. Good. All right, now we'll do the patellar. All right, just want to make sure your leg is hanging loose there. There we go. Okay, and also Achilles. Very good. You have a great tendon reflex.
Thank you.
All right, one more thing though.
Tickles.
I just had to check and see. That's checking for Babinski's reflex, and you're negative. So that's a good thing.
Isn't that something that children usually have, like kids?
It is. But as we grow, we lose that, and that would be where your toes flare. So we're happy that you don't have that anymore.
Okay.
You probably did as a baby though.
Yeah.
All right. So now what I'm going to have you do is stand and walk for me. And so when you walk away, walk heel to toe, just like this.
All right.
Go ahead. Very good. Now as you walk back to me, walk on your toes and then on your heels. Very good. All right, let me have you stand there. Can you stand on one leg? And can you do a little knee bend on each leg? Okay, and also now with your eyes closed, run the heel of your foot down the shin. Very good. All right, so now what I'd like to have you do is turn away from me and bend over so that I can see your spine. Nice and straight. Okay, so now I'm going to stabilize your pelvis, and what I want you to do is bend side to side and back and forth. Very good. Now rotate just a little bit. Nice. You have good range of motion. Okay, so normally we would do an examination of your genitalia and your rectum, but for the purposes of this video, we won't do that. But one thing that I do want to talk about, because it's so important, is testicular self-exam. Have you heard of that before?
No, ma'am. What's that entail?
Well, that's where you just check to make sure you don't have any lumps or anything growing as far as cancer goes in your testicles. So I'm going to teach you how to do it, and it's important that you do it about once a month. The best time to do it is in the shower when everything's warm and loose. So you take the scrotum between your 3 fingers like this, and you roll it around the testicles to feel for any nodules or lumps.
Okay.
Okay? And it's important to know how it feels when you're healthy so that you can spot anything if it were to happen. Okay?
Okay, so you just do that once a month in the shower.
Yep, in the shower. Just looking for lumps or nodules or anything that might represent a cancerous growth.
Sounds easy enough.
It is easy. So, Erin, you look like you're in very good health. And I recommend that you drink plenty of water and keep doing what you're doing, because you've been taking pretty good care of yourself.
Thank you.
All right. Well,
thanks for the checkup.
Yeah, thanks for coming in today. And I guess I'll see you next year.
All right, well, good luck on your grade.
Thank you. And that's it. A complete head-to-toe assessment.